My Lords, this is a very short bill, undoubtedly presented with the best of intentions, but it raises some big and difficult questions. The first one is to ask why there are no definitions in the bill, very importantly of gender identity, but also none of practice, suppress, aimed, and demonstrates an assumption. This means that interpretations are likely to be highly subjective as well as being left to the court to sort out. How can something be banned when it cannot be defined? My second question is whether the bill represents a serious overreach into behaviour that should not be criminalised, in effect creating a thought or speech crime. I'd like to ask what examples of action or speech my noble friend Baroness Burt or other supporters of the bill can give of a real gap in the law where, for example, police, prosecutors or courts have told complainants that they could not act or convict. Practices that amount to physical or mental abuse, torture or inhuman treatment are, of course, very rightly already illegal. The bill requires no evidence of harm or injury for the offence to be committed. And what room it allows for sincere and voluntary conversations, safeguarding or protection of health and well-being, is thoroughly unclear. The very use of the term conversion therapy is a misnomer, a confusing one, as I think my noble friend accepted, but it's still the core of the bill, conversion therapy. But it risks tarring the therapy community. None of us wants to see any pressure or coercion used on people, but explorative talking therapy by mental health professionals when all aspects of the person's feelings can be examined is an entirely different matter. The Equalities and Human Rights Commission has advised that there needs to be care in drafting so as not to catch legitimate counselling, therapy and support. So my second question is how the bill, with its lack of any exemptions or exceptions, avoids the risk that anything other than immediate affirmation will put a therapist or clinician at risk of being accused of a conversion practice when their professional duty is to support the person as they explore exactly what it is they want. My fourth concern is that the bill conflates sexuality or sexual orientation with gender dysphoria when they are very different things. The evidence suggests, as Minister Kemi Badenoch noted in her recent letter to the Women and Equalities Committee, that a high proportion of young people who present as struggling with their sex actually turn out to be gay, and that, quote, if gender non-conformity is misinterpreted as evidence of being transgender and a child is medically affirmed, the child may not have had a chance to identify, come to terms with or explore a same-sex orientation. And that, quote, early hormone therapy may interfere with the patient's development as a homosexual. So immediate affirmation of a change in gender identity, rather than watchful waiting, could be gay conversion therapy. What are the safeguards against that? How does this bill avoid the hugely dangerous risk of treating a young person inappropriately and prescribing puberty blockers and cross-sex hormones when they are in fact gay? In its June 2023 statement, NHS England noted both the rise in autistic young people seeking gender transition and the, quote, dramatic change in the case mix of referrals from predominantly birth-registered males to predominantly birth-registered females presenting with gender incongruence in early teen years. Perhaps when we see the horrendous sexualised pressure that teenage girls are under, a wish to escape from being female can be understood. But under this bill's proposal, could a parent be convicted for refusing, perhaps because of the above concerns, to affirm the child's request to change gender or agree to puberty blockers, as in the Australian state of Victoria? A parent's duty surely to protect the child, and in many areas of a child's life to discuss issues and to say no or wait if they feel that is more appropriate. Leading human rights barrister Jason Koppel KC has raised the risk of unjustified or unlawful restrictions contrary to the European Convention of Human Rights on the right to manifest religion and belief or on freedom of expression. A person like me would be highly unsympathetic to spiritual guidance that, for instance, said homosexuality or same-sex marriage was a sin, but it would be a dramatic departure for that to be made a criminal offence. Has the bill, in fact, been subject to an examination of its human rights compliance by the author? If so, it would be very good to see this published. Finally, my lords, it would certainly be premature to legislate until we've seen the final report of the cash review, which is expected soon.
My lords, I very